Okay, think about this for a second. Hospitals,
Oh.
places we go to heal, right?
Mm-hmm.
But what if I told you they're actually significant contributors to climate change?
Yeah, it does sound a bit strange at first.
And the source. Often, it's the anesthetic gases themselves.
Exactly. And that's what we're digging into today. There's this really interesting study out of the General Hospital, Vienna.
Vienna, okay.
Yeah, and they looked at how anesthesia teams there feel about sustainable practices, things like precycling and recycling these anesthetic gases.
So not just what they're doing, but their perspective on it.
Precisely. And, well, how that perception lines up or doesn't with what's actually happening, it reveals quite a bit about the challenges in making healthcare greener.
So let's break down the problem first. These anesthetic gases. We're talking about things like sevoflurane, desflurane, nitrous oxide.
That's right. They're essential for procedures, but they are, unfortunately, pretty potent greenhouse gases.
And one is much worse than others, isn't it? Desflurane.
Oh, absolutely. Desflurane's global warming potential is significantly higher. Here's the real kicker.
Yeah.
Over 95% of the gas a patient exhales, it usually just gets vented out, unfiltered, straight into the atmosphere.
95%. Wow.
It's a huge amount. So this Vienna study looks at two main ways to tackle this: precycling and recycling.
Okay, let's define those. Precycling.
Think of it as preventing waste before it happens. So using lower flow rates of the fresh gas, maybe choosing different anesthetic techniques altogether to just, well, reduce the amount of volatile gas used in the first place.
Makes sense. Avoidance and recycling.
Recycling is the active capture part, using technology, often charcoal filters or adsorbers, to trap the exhaled anesthetic gases.
So you can potentially clean them up and reuse them.
That's the goal, yeah.
Yeah.
Capture, purify, reuse.
Got it. So back to the Vienna study. They surveyed the staff. What did they find? Was there enthusiasm for this stuff?
Oh, absolutely. The numbers were pretty striking. They surveyed 103 team members, and get this, 91% said they were willing to accept extra effort to recycle anesthetics.
91%. That's huge.
It is. And 88% believed it helps the environment and is, importantly, safe for patients. So the willingness is definitely there.
But I sense there's a but coming.
There is indeed. Despite all that goodwill, nearly 60% of the staff admitted they had pretty limited knowledge about the actual recycling technology.
So they're willing, but maybe don't feel fully equipped or informed.
Exactly. And you see this reflected in practice. They have this advanced capture system, the Zeosys adsorber.
Yeah.
It was only installed and operational in 3 out of their 60 operating rooms at the time of the study.
3 out of 60. Okay, that's a big gap between willingness and implementation.
A really big gap.
But it wasn't all about the new tech, right? Did they
Yeah.
find positive things already happening?
Yes, definitely. For example, low-flow anesthesia, that's a precycling technique, basically using the machine to rebreathe some gas, reducing overall consumption. That's widely used. About 68% reported using it regularly.
Okay, so that's good. That's already making a difference.
Right. And they also noted that things like hospital green teams, groups promoting sustainability initiatives, were well known and acknowledged.
What about other feedback? Did staff have other ideas or concerns?
They did. The qualitative comments were really insightful. Staff are clearly aware that anesthesia is very energy intensive.
Beyond just the gases themselves.
Exactly. They brought up broader changes like shifting the hospital to renewable energy sources, promoting green mobility, like transport options.
Interesting. Thinking systemically.
Right. And they also mentioned practical things within the OR, like needing better systems for segregating waste. Plus, a strong belief that quite often these volatile anesthetics could be replaced by other greener methods.
So boiling it down, the Vienna experience highlights this paradox.
I think that's a good way to put it. You have this immense personal commitment, this real desire among staff to be sustainable.
Yeah.
But then you have these practical barriers. Limited access to the recycling tech, sure, but also a clear need for more specific training and knowledge.
So while the fancy recycling tech is promising.
It is, but the study suggests that maybe the precycling efforts, just using less gas, optimizing flows, reusing equipment safely, might actually be more feasible and have a bigger immediate impact in many places.
And getting that support from the top, from hospital management, is key.
Absolutely crucial. It needs proactive support, investment, making it standard practice, not just a nice idea.
This whole deep dive, it really makes you think beyond just hospitals. How do we bridge that gap more broadly between people wanting to do the right thing for the environment and the systemic barriers that slow things down.
That's the big question, isn't it? And maybe that precycling idea, preventing waste at the source, is something we can all think about, in our own lives. What small shifts can you make to consume more mindfully, to avoid waste before it even becomes waste? It fosters that broader culture change, doesn't it? Beyond just the operating room.
A really powerful thought to end on, how to apply that pre-cycling mindset everywhere.